Access Fort Wayne offers reflections of our community. Production facilities provided by Access Fort Wayne are a service of the Allen County Public Library. The views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting organizations. For more information about creating your own television program with Access Fort Wayne, call 421-1250.
Hi, I'm Dr. Rudy Cashman, neurosurgeon in Fort Wayne, Indiana for 41 years at age 39. Okay, tonight we're going to have a very interesting show. Thank you for watching our show periodically here. I'm really a mind-body doctor. I'm a neurosurgeon. You can call me Dr. Wellness. And tonight is a very interesting subject, something that's very important to our lives, the addicted brain. And we're not speaking just here about narcotics. We're talking about food and gambling and the whole field of addiction. And how does that happen in our brain? What's the neurocircuitry involved? We'll discuss that in great detail here. So tonight's subject is the addicted brain. So let's begin. What's drug addiction? What is drug addiction? It's a chronic relapsing disorder, comes and goes, characterized by craving for the drug or even an activity. It can be something like gambling. Loss of control, consumption of the drug despite negative consequences, bad things are happening to us, and withdrawal symptoms. You don't take it, you feel changes in your physical body and in your brain when the drug ceases. Preoccupation, anticipation, and withdrawal from the drug leads to dysfunction, unemployment, homelessness, divorce, and often premature death. Death is not uncommon. 18,000 deaths last year in this country. But dysfunction, that you're not functioning anymore, or that you need to be on disability, that you can't work, that's in the millions in this country. It's in the millions. So this is a very interesting subject today. Am I addicted? You might say, am I addicted? Well, let's go through a few questions you need to ask yourself. Are you craving for the drug? Are you thinking about it? Are you looking at cues? Are you with friends and you're thinking about the drug? If you have 3 or 4 of the following 9 or 10, then you may be addicted. Do you have withdrawal symptoms from the drug? Do you feel symptoms of withdrawal from it? You're thinking about it. You're getting numb. Your stomach is gurgling. You're getting dizzy. Withdrawal symptoms. Are you increasing the use of it? Are you developing tolerance? Is really the next thing. In other words, tolerance means you get to take more of it every few months, every few weeks, over the years. You're taking more and more. Are you developing tolerance? Is using the drug or doing the activity, does that stop the withdrawal symptoms? That's something to look at. Are you using repeated efforts to stop, but it's unsuccessful? That's one of the 3 or 4 out of 10 we're speaking about. Do you have trouble at work? Are you missing days at work? Are you intoxicated at times and having to take a day off because of it? Are you having increasing problems with social activities, with work activities, with recreational activities, emotional activities? Are you starting to have problems with stealing from family members and neighbors and problems with the law? Are you getting arrested now and then? If you have 3 or 4 of these, you may be an addict. You may be an addict. But remember, we're not speaking just about food. We're speaking about narcotics. We may be speaking about sex, about gambling. So addiction is complex. Why can't addicts just quit? Because addiction changes the circuitry of the brain. Addiction changes the circuitry of the brain. That is why our neurotransmitter change. And I'll explain that before the evening is out in great detail so you understand. Let's talk about the neurobiology, the chemistry of addiction. What's involved here? Research has been done in animals, and they've tested animals, monkeys, for example, and rats, and fed them food and fed them narcotics, cocaine and heroin, and had them see how quickly they became addicted to the substance. Which one would they pick first, for example? Some of the rats that were studied would pick food first. Others were studied would pick cocaine every time. So studies have been done. And they can now do it scientifically with PET scans, with SPECT scans, and MRI scans of the brain. They can demonstrate the neurotransmitters in the brain and the circuits that are involved. What lights up, for example, in these different types of scans. So in this revealed the dopamine circuitry. Dopamine is a small molecule that makes us feel good. Laughter, dancing, eating food, narcotics can make us feel good. It's dopamine and serotonin are the chemicals involved, and many others. But the neurobiology involves neurons, circuits, and neurotransmitters. Neurotransmitters, and I'll show you in a good illustration later, are the chemicals that jump from an axon to a dendrite to carry the chemical electrical impulse that makes the next nerve move. And I'll have a nice illustration coming up on that. To continue here, here's a side view of the middle of the brain, and this demonstrates the reward circuitry. It's mainly at the base of the brain. It involves the frontal lobe, involves the nucleus accumbens, which is sort of in the medial posterior frontal lobe, very millimeters in size, but it's full of serotonin and dopamine that makes us feel good. That's the nucleus most likely affected by food. It hits the nucleus accumbens and dopamine is secreted, and we feel good. And the circuitry involves the frontal lobe, the hypothalamus, the limbic system, the VTA, the ventral tegmental area at the base of the brain. So it's a whole circuitry that is involved in the dopamine circuitry. But remember what I said, the dopamine circuitry is affected by laughter, by coffee, by cigarettes, by narcotics, the opioids, by morphine, by heroin. It's really all on the same railway, We're just trying to feel good. We're trying to get to normal, while some of us are trying to get a high. Let me name the four main systems involved that they have now revealed. The mesodopamine system, you don't need to remember its names. I just want you to know these are circuits that exist at the base of the brain. Opioid peptide system, the gamma-aminobutyric acid system. The main chemicals we'll be speaking about, the neurotransmitters, which are the proteins that jump from axon to dendrite, dopamine, serotonin, make us feel good. Norepinephrine makes us feel good. GABA relaxes us. GABA is the neurotransmitter commonly produced by alcohol. Nicotine uses the acetylcholine emitter. We can demonstrate this very well with SPECT scans, which involve the use of the sugar molecule, and since sugar is used in the brain for nutrition in our brain, so if you label it with radioisotopes, you can see that could light up the brain depending what part of the brain at that moment is being used, and it's being used, it uses sugar. That way we can demonstrate if a person is eating food, for example, the nucleus accumbens just lights up and beautifully. So, and physical changes in the brain that control decision making and learning affected by drugs. So for that reason, people with, say, opioid problems, for example. It explains the loss of memory, their impulsiveness, their compulsiveness, their behavior, their loss of memory. So it explains impulsive and compulsive activity, which leads to addiction. The dopamine system itself starts in the frontal lobe, the PFC, connects to the nucleus accumbens a little further back, and then it hits the extended amygdala, which is the medial part of the temporal lobe, then goes through the limbic system, which is above that, and the hypothalamus, which is just above the pituitary system. So we're talking about a circuits and a system that interacts and is greatly affected by all the substances that we've mentioned. Now here's a very nice view of the dopamine pathways and the serotonin pathways on your screen. You see the frontal cortex there with yellow arrows. That's the dopamine pathways, which motivates you, gives pleasure, euphoria, makes you feel good, leads to compulsion. And then you see the nucleus accumbens, you see that there, and then the effects in the hypothalamus, the striatum, the substantia nigra, that's all part of the dopamine system. And now the serotonin pathways, more to the right, the effects in the hippocampus, the raphe nucleus, it affects mood, memory, processing, sleep, cognition. This is an illustration from the National Drug Administration. I think a very nice demonstration. And in this here, I'd like to really have a close look at it, because this is what addiction and neurotransmitters really is all about. When you look at the axon above, you see these blue dots, these fairly large blue dots. They are vesicles. They are little carrion pouches with membranes, and they have in them the chemicals themselves. So they're little pouches that carry the neurotransmitters around, depending, and they come from the nucleus of the cell, which is further up north on this slide, and the nucleus sends those down in these little containers. This little round, you can look at them as hockey pucks, for example, full of little chemicals, very nicely done. And then they reach the synaptic cleft. That's the blank space between the two big structures you're looking at. And you see the door has been opened, and they pour out what's called a synaptic cleft. That's the area between the axon and the dendrite, and these chemicals go into there, and then they go to the dendrite and attach themselves to a receptor. That's sticks out there, many millions of them, and each receptor is built for a specific neurotransmitter. Like dopamine will have a certain protein receptor, versus acetylcholine will have a different receptor. So the dopamine, for example, will hit the receptor, and then the dopamine and causes it to act, and then the dopamine will get back into the synaptic cleft, and then it must be cleared out of there. It has to be cleared out of there, and is transported by the dopamine transporter, the DAP, it's called the DAP, and is brought back into the axon and stored again so it can be used again. I bet you will learn soon. The problem is, for example, you take cocaine. Cocaine affects the DAP transporter and will not allow the dopamine to go back into the axon, and you get a tremendous amount of dopamine in the synaptic cleft, and you have this tremendous, overwhelming high. That's why drugs are dangerous. Because they don't allow dopamine to be cleared back out, and you get this tremendous high, and you want to get it again. Because it's beyond what you can normally do with music or laughter or exercise or meditation, and it becomes addictive. The neurocircuitry will be changed. The drug you take in doesn't have exact receptor site to go to, and through evolution, there's no way of clearing that out of the synaptic area. So it keeps on stimulating the receptors, and that's the reason. And the only way you can get rid of the cocaine, for example, it has to get in the blood system, and it's metabolized in your liver, not in the synaptic cleft, where they get rid of the neurotransmitters by diffusion, by breaking them up, or by being taken up again. That's called reuptake. So let's move on here. Most addictive, many things are very addictive, but I tell you the most addictive substance there is, and I've debated it with other people, I tend to think they're right, it's food. Let's review now the most addictive substances. Interesting enough, a lot of people think it's food. I've debated this subject before because we have to eat every day. Food may be the most addictive substance. Cigarettes certainly affect the nicotinic receptors, acetylcholine, and smokers, of course, smoke because it raises their acetylcholine level, and they feel better. Alcohol raises the GABA level and is a relaxer, and many people become addicted to that. But again, it's the same circuitry at the base of the brain that's involved here. And heroin is a real quick rush and causes the chemical dopamine to be released and makes us tremendous high very, very quickly. And what heroin does also shuts down, and it causes excitement. It excites the receptors. Cocaine is another neurotransmitter that ends up in the synaptic cleft and excites the neuroreceptors, and is very different. We don't have an evolutionary time, a way of clearing this out of the synaptic cleft, so these things have to metabolized in the liver. Morphine, opioids, gambling, sex is a big one. Drug users will tell you that heroin, for example, gives them 10 times the high that sex would give them. So you can see the addictive nature of these medications. Phenothiazines also are medications that affect neurotransmitters. One of the biggest things in chronic uses of say, illegal drugs, for example, is loss of functionality leading to death. You know, we have a certain number of deaths for an overuse of medications. Today, unfortunately, it's physician prescriptions is a very common cause, but if it killed 18,000 people in the nation last year from physician narcotic prescriptions, that's a fact. 109,000 over the last 10 years, but it has reduced patients to loss of their jobs, loss of functionality in the millions. They're on disability. We've doubled our people on Social Security disability the last 10 years, partly due to economics, but a significant amount actually is due to drug addiction. And then we had 70 deaths in Allen County in the last 3 years, 109,000 in 10 years in the country, and 18,000, as I mentioned, in this last year in the U.S. from physician narcotic prescriptions. That's why you have to be very careful if you accept a narcotic prescription for not a very good reason. You get cancer, you get a broken leg, you had a heart attack, you had a ruptured bowel, take a narcotic. But don't take it because you get a little neck ache or a backache. You got to have a good reason. You must participate in your health care and decide when or not to accept a prescription. We're much too liberal in handing these prescriptions out. And that tolerance is what develops after you've taken the medication. After a while, it doesn't work. I mean, I know of a pain center, for example, in the city, where every time you go, every monthly visit, they increase your medication. Very dangerous, because they develop tolerance. You develop tolerance. It doesn't work for you anymore. And so as you, every month you increase the medication, of course, you're going to become an addict in the end. And the odds of getting off the medication is not good. It's not good. So prevention is critical. The amount of dopamine that's being secreted because you're taking the drugs is changing. It is changing. It is not producing as much dopamine. You don't feel as good. Repeated drug use will change the amount needed. You're trying to get to normal. You just want to feel good. Almost, you know, a legally created addict with from a prescription, you almost feel sorry for them because many of them are no longer responsible for the decision. They're just trying to get. They're just trying to get to normal. And let's talk about the allostatic state for a minute. That's equilibrium, okay? There's decreased reward circuitry. You're not getting the reward like you used to do for taking a certain medication and the amount of it. There are decreased receptors. The receptors are dying out, and that's the problem, for example, with food addiction. Food doesn't work as good anymore, so you need to eat more food to get the same feeling again, and so it is with narcotics. And you have decreased GABA is being produced in alcohol, for example. Remember, the GABA is a neurotransmitter that makes you feel a bit better, but you're having a drink, not as much GABA neurotransmitters being produced, so you need to drink more, and you're slowly becoming addicted. And there's a regulation of neurotransmitter function by the human brain, but as you take drugs, they last longer, their effect is bigger, and there is no history in evolution to help you regulate all those drugs in your brain, and the circuitry is getting mixed up, and you're slowly becoming addicted because your brain can't straighten things out. And there's a chronic elevation in reward thresholds. It takes a lot more drug, it takes a lot more food, it takes a lot more heroin to make you feel even normal, no less to get a high. That's the addictive process. And you're very vulnerable to relapse. You may, maybe occasionally get off it a little bit and bang, first time you have a cue, you see it, you're among your friends, you're at a party, you're at a bar, you're off and running with your addictive substance again. The extended amygdala, which we talked about earlier, is in the medial temporal lobe, in the prefrontal area, the nucleus accumbens, the ventral tegmental system. This is this dopamine, serotonin, GABA neuro circuitry, and that changes to time. These drugs will change the proteins in your body and the genes in your body. Actually, we have 89 genes that can regulate addiction. Just think of it, 89 genes they've proven in genetics can be affected by addiction. Let's talk about the anatomy of addiction a little bit. 1991 to 2010, narcotics, the addicts were there in 1991, but now and has tripled. It used to be 75.5 million in 1991. Now we have about 210 million in 2010, a tremendous increase. And you can become addicted incidentally to anything. You can be addicted to heroin, for example, in a week, or methadone in a week. Somebody else might take a year. Some people, it can occur in a week. You'll be very careful taking these medications. You can be addicted to food, sex, cigarettes, gambling, work, drugs. And drugs give you increasing warmth, relief, euphoria. You're feeling good. Everything is right in the world. And after a while, it doesn't work as well. Depression, physical illness, compulsive use. You can't stop it. The pleasure pathway. We have a pleasure pathway in our brain, and the reason we have it is through evolution. Through evolution, we've made certain things pleasurable, like sex made it pleasurable so that we would keep on reproducing. We made eating pleasurable so that we keep on eating, to keep our species alive. That's the pleasure pathway. But our brain has learned to change our genes and our DNA through neuroplasticity. Our brain can change. Our brain can learn. Even in our 70s, 80s, and 90s, we do grow some new brain cells, and our brain cells change depending what we do, depending on what we eat, depending on what we drink, what drugs we take. So neural circuits are changing throughout our life, but they change a lot quicker in a young person. Their brain isn't as well developed. So for a child to be smoking, for example, and using drugs at age 10 or 12, 82% chance of becoming a drug addict. A child's brain is not properly developed, so addicted child really is a horrible thing. And if you have a child with these problems, you must get them the treatment quickly, because the brain has not properly developed, and they will become drug addicts later on. So if a parent is smoking and drinking and using drugs, and the child sees this and does this, the odds of that child being a drug addict probably is 90%. 90%. And maybe tell you something before we go any further. When a person is truly addicted. Nothing means anything. Father, mother, church, society, job, nothing means anything to that person except to get their fix. Nothing means anything. So to addict a person, like by prescription, frankly, is sinful. I mean, it's sinful. And that person may never get off of that. And so we're talking about the reward and reinforcement pathway. Drug dependence really is the same thing as addiction. They changed the terminology over the years, but it's really the same thing. It's impulsivity to compulsivity leads to addiction. Let's go through the ABCs of addiction a little bit. You have the nerve cell. We talked about that. We have billions, 100 billions in our body. We've got 100 trillion neurotransmitters, okay? I mean, so we have the nerve cell, the axon from that, and then the synaptic cleft, and then the dendrite. We talked about that. In the synaptic cleft, that's a space between the axon and the dendrite. I showed you the picture. Neurotransmitters play their games, okay? There's hundreds of neurotransmitters, okay? And each one has a specific receptor for that specific chemical, okay? Neurotransmitters are made in the nucleus of the nerve cell, and then you go down these little vesicles, for example, to the synaptic cleft. The doors open, they put in the cleft, they hit the receptor of the dendrite, and they bounce off quickly. Now they're in the cleft. Remember I said that? And they have to be either diffused, broken up, or re-up. They taken up again by the previous axon and used over again. And so neurotransmitters are carried in these little transport vehicles. Remember I talked about the hockey pucks and in these full of little vesicles. Incidentally, your memory is located in these vesicles. These vesicles have about 500 molecules per vesicle. That can be your memory. And that's all traveling down this axon too. So dopamine is a small molecule. Endorphins, your own feel-good neurotransmitters, which you get, say, from running, dancing, music, something. Your own endorphins that make you feel good, laughter. They're large molecules. And the GABA neurotransmitter calms you. Glutamate, which is very commonly excited in alcoholics, makes them wild, excitable. They can have seizures as they're withdrawing, for example. If you see a person who drinks a lot just going crazy, it's that glutamate. Some of you may be living with that. You may have a family member who does that. It's just totally out of hand. That's glutamate at work. And the goal, the receptors, remember, many coming off the distal dendrite, the synaptic cleft, and every different neurotransmitter has a specific receptor site. It's like a key to a lock, and it unlocks the action of that cell by, and the dopamine, for example, is the key that unlocks the door to neurotransmission to the next dendrite. They act, and then they go away from the receptor. Very interesting. And some are taken back up and go back into the axon, and the little vehicles that do that. And I remember I said external drugs that we take will block the reuptake of dopamine, and it hangs around like if you take cocaine and heroin, and this dopamine is tremendous amount in the cleft because you can't take it back up. It can't be broken up, and it can't diffuse. And so it gives you a tremendous high that people would try to recreate because they're trying to feel good. Cocaine, amphetamine, and methamphetamine stimulate the receptor. Okay, they don't just unlock it; they stimulate it, especially methamphetamine. That's why people get involved with it, because it gives a tremendous high. It gives a tremendous high, and of course we see many deaths from it because to make it is very dangerous. So drugs are not as easily removed from the synaptic cleft. The external ones that you take, they act longer. The body doesn't know how to get rid of them. That through evolution, there has not been a neurotransmitter that transport them away. They have to be detoxified by the liver, and that takes a long time to get there, and it does it slowly. So they last longer, great effect. I'm talking about external drugs now, and epigenetics. You hear this term now and then. That's the ability to change your genes, and we have neuroplasticity. Remember, we can We can change a neurotransmitter. We can change neural cells. And we have synaptic plasticity. In the synapse, we can change the receptors through genetic and DNA alteration, which can occur by external drugs, unfortunately, and we produce some proteins that we don't want, receptors that we don't want. And so it changes the proteins in the circuitry. That's what blood addiction does. It changes the proteins through neuroplasticity, synaptic plasticity, and through epigenetics. Changes the actual proteins. And so the long-term changes in the brain from drugs, the long-term changes. And they see them in autopsies, for example. And that's been proven. Addiction, non-regular rewards are more addicting. Yes, something you do intermittently and not every day is more addictive. They've proven that in annual behavior. If they just give that food or that cocaine, now and then as they hit this lever, now and then, that is more addictive, results in more drug-seeking behavior than to do it regularly. A very interesting point. And of course, cues stimulate drug-seeking behavior. A friend, a party, music, a certain bar can result in drug-seeking behavior. And what are the people? What's the problem? And all these people have these problems, whether it be nicotine or food or drugs or whatever. Lack of dopamine, lack of serotonin, lack of GABA. That's in their lives. So need to develop other systems, other ways of bringing joy into their life. Cocaine's action. Cocaine blocks dopamine transporter and reuptake. So the dopamine is not taken up again and remains in the synaptic cleft. I think you understand that. So the synaptic cleft is full of dopamine. The brain can change in neuroplasticity, epigenetics. We talked about that. Drugs dominate, external drugs dominate the system, and there's no defense. There's been nothing in evolution that told us how to handle with the drugs in the synaptic cleft. No evolutionary history. So intolerance change the neurotransmitter and circuitry, and that's the reason you need to go back, higher dose, more alcohol, more cigarettes, more cocaine, because the neurotransmitters aren't working anymore, and you want the same high, so you take more. More. Tolerance and sensitivity. Remember, we mentioned with drugs developing tolerance, you always need more. Also, it makes the skin a lot more sensitive. That's another side effect. So you see drug addicts rubbing their skin all the time. You have a child at home that's doing that. Be careful. There could be something going on here you don't know about. And to get, just for a second, a little more specific, it's in the molecules. It's in the molecules we're talking about. A molecule is the smallest amount it takes to still have all the chemical properties. That's called a molecule. And remember, we talked about gene expression. We have 89 genes that affect addiction. So it's addiction history in the family. Watch out, especially careful. But our genes can change. Our external drugs can change our genes through epigenetics, genetic structure. So a neurotransmitter is the hand that touches the doorknob that opens the door. Cocaine is increased, causes change in the chemicals in the gene expression. So plasticity is the ability of the brain to change from a stimulus. We brought this up. I think you can understand this now. Drugs and sex. People will tell you that drugs, cocaine, heroin, 10, 20 times more high and overwhelming good feeling than sex, for example. And so to feel good is in our evolutionary history to keep us alive, to keep us eating, to keep us keep having sex and reproducing. So that's in our evolutionary history. And let me read you a poem. I was writing a book about drug addiction, a couple of books now, and I was watching two little children dance, and I saw the joy in this dance, but also I'm writing about addiction. So I'd like to read this poem. And if you need a copy, you can get our website, we'll get you a copy. Joy is the answer. Joy is the answer. The joy of children. Mind you, I'm watching two children dance, okay? The joy of children True innocence without fear. Dancing alone to the music. Happiness at its best. Laughing all the while. Joy is the answer. Remember, I'm watching two little girls dancing by themselves. The anxiety, fears, and stress of adolescence. The music stops for some. Cigarettes, alcohol, and drugs appear to raise the mood temporarily. Looking for the right thing in the wrong place. Tolerance, dependence, and addiction appear. Joy is the answer. The road to hell after a spell. Nothing means anything. Mother and father, friend, God and society, peers, your friends appear and don't cover the rear and make things worse. Joy is the answer. Hopelessness, depression, no ecstasy, paradise is lost. Joy is the answer. A hug and a kiss produces the bliss. Laughter and warmth awakens the doctor within us. Love can raise the dopamine in us. Don't accept the opioid script for you and your kid. Love, joy, and mindfulness is the answer. Thank you for listening to that. It came to me just watching two children dancing separately from each other on a dance floor. So today, I hope I've begun to give you some understanding what addiction is all about. It's an evolutionary dopamine serotonin system in our body. We all have it, and we need to develop better ways of bringing out joy, from exercise to music to meditation, to reduce our stress levels. Stress is a great cause of drug addiction. Many of us are leading very stressful lives. People are losing their houses, they're losing their jobs. So addiction is more common in the people having socioeconomic problems. There's no question about that. Because they're just trying to feel good. They're trying to feel decent. So when I see providers writing prescriptions for patients for no good reasons, just from narcotics, for just a backache, just a low backache, no broken bone, no cancer, no busted gut, no heart attack, I don't agree with it. The reason being, if you do it short term for a week or two, I might even go along with it. But there has to be an end point. One of my books I wrote, The Fraud of Chronic Pain, I have a chapter called The End Point. There has to be an end point. When other modalities should be used to treat chronic pain, half the people, at least, that see a provider for a pain problem, their main problem isn't something broken or a busted gut or something. It's anxiety, it's fear, it's hopelessness, it's stress. You have to figure that out. Especially giving a narcotic to a young woman, for example, can be very dangerous if you don't have a good reason, especially because she can become pregnant. And if she's become addicted, can be dependency and addiction really are essentially the same terms. It's been defined by the American Psychiatric Association in 1994, but even the World Health definition thinks dependency and addiction are really are the same terms. In the state of West Virginia, 10% of the children born today are drug addicts. They have to put them on methadone, and some use morphine to get them off the medications. And many of them have lifetime effects. So especially for a young woman, these are extremely dangerous, especially in the elderly. What should a narcotic be used for pain? I mean, obviously, a lot of trauma situations, emergency rooms, morphine dilaudid, not a problem. It's short-term use. It's just that you can't keep it going beyond a certain period of time, or you can convert that person to an addict. And don't accept some of these narcotic medications. I see 80-year-olds, on OxyContin, for example, a very dangerous drug. Very dangerous drug. You get cancer, for Pete's sake, take the darn thing. A shark bit off your leg and you've got phantom limb syndrome, for Pete's sake, take it. But I tell you, narcotics work only 30% of the time, only 30% of the time, and are effective only for short periods of time. Most patients will tell you the narcotic isn't working because they're developing tolerance. They want more of it. They want more of it. So I think to be very careful what you accept as a prescription for narcotic medication. I've seen it in children. I have one child that's, I wrote a story in one of my books, I even put his picture in there, who went to a pain center for what I think was a very good student, a fibromyalgia type thing, and came to see me. He had a basket full of narcotic medications. I got him off essentially everything at the moment, and he's going to college, and he needed to write a term paper. He wrote it on pain centers across the nation, and it is a great term paper. It'll be one of my books. I've written a number of books. The Fraud of Chronic Pain, that's out on Amazon, and you can get it at most places. Then I have another one pretty well done called Pain. We need a new definition. You see my point? I mean, 10% of pain is acute, okay? Something broken, something busted, okay? 10% is neuropathic, nerve damage, pinched nerve, trigeminal neuralgia, heart attack, okay? That's another 10%, okay? And then 10% is nociceptive. That's tennis elbow, which I'm familiar with, being a tennis player, I'm sure as I have it, bursitis. And that can be treated with anti-inflammatories, maybe a week or two occasionally with a narcotic. So we get 50% of the people, we don't know why they hurt. We don't know why they hurt. But what happens a lot is they have x-rays done, okay? X-rays, say of the neck and the low back. And they'll indicate degenerative disc disease, drying out of the disc, which can occur to anybody at any age. And many times these are overread. They're overread. Say, here's your problem, what I call the nocebo. The placebo is I believe, I hand you a pill, and if you believe it, odds of it working a good 70%. If you do an MRI and you get a 3-page report, and I tell you it's got something to do with your problem, odds are you believe it, and it might stick a needle in you, or maybe you can do an operation here and there. It may or may not have something to do with your problem. That's the nocebo, negative speak. Not used commonly in medicine, but I wrote a book called Nocebo, the Evil Twin. You can see that it is an evil twin, because all this negative talk about your angiogram or your MRI scan or your CT scan can convince you to have something done, when in reality, maybe you need it and maybe you don't. And sometimes, indeed, that you don't. That you don't. I see this used a lot by pain centers for injections to give you a narcotic, because a narcotic will then make a permanent customer out of you. Not every pain center, but significant number, all over the country, all over the nation. So you be very careful when you go there, unless you have a very good reason that you're not being misled by the nocebo, and understand the placebo, and try other methods of exercise, massage, laughter, yoga activity, Tai Chi, Qigong, but you got to participate. You must participate in your health care. About 70% of the people, unfortunately, in the medical literature, it's not just from my opinion, although it's also my experience, don't have a big interest in participating in their health care. Very poor decision. What I like to see, like today I saw a patient at the hospital, and I see a daughter sitting there with a big yellow pad, and she's taking notes on everything I said, and she wants copies of the laboratory tests, and she was copies of her MRI report of her 90-year-old mother. And I told her, I congratulated her. It's a wonderful thing to have a family member, for example, to be that interested, for one thing. I think is a great thing. And some people might look at it as, boy, are they a pain in the blankety blank. But I'll tell you honestly, it's a wonderful thing. And because you need somebody to look after grandma, and you need to keep participate in your whole health care. You must do some reading. I commonly, when I see patients, because I do a lot of mind-body teaching, a lot of weight loss teaching, for example, give them books and CDs and DVDs and things like that to read, so that I educate them about weight loss. And I have a significant number of patients that listen to the CDs and DVDs and audiobooks and things that I have and made themselves well. I have one picture on my phone I gladly show to anybody. That was about a week ago Friday. I saw a man and wife. They both had type 2 diabetes. They were overweight, but not horribly so. But one lost 20 pounds, the other lost 26 pounds. And I have them on the same picture. Both patients lost their type 2 diabetes. Hallelujah to that. I wonder how many people could say that. I mean, that's this great. Get a normal body index, you get rid of it. And so it is, with pain problems. You have to be very careful the medications that you accept. I mean, somebody's dying from cancer, please take IV narcotics. That doesn't concern me. What concerns me is the ordinary person, the children with fibromyalgia. For example, I don't think fibromyalgia is worth a narcotic. I think it's worth a massage and it's worth exercise and some non-addictive pain medication, but not a narcotic because you become addicted. Remember what's happened? You become an addict. Addict. You know what happens? Remember what I said? Family, mother, brother, sister, God, and society mean nothing. Nothing. All you're worried about is where the next fix is coming from, and that person cannot control it. That person cannot control it. So the avoidance of the addictive process is extremely important. And in this country, we're having really at this time a heck of a problem with it. And we must work on this. And I've been working very hard on it. In my Fraud of Chronic Pain book, I very carefully explained that 50% that we don't know, what's wrong. We don't know what's wrong. They're anxious, hopeless, anxiety, depression. I put up a name for them. I call it metabolic pain. So I'm speaking to the phone to another doctor. Say, I have a patient here with metabolic pain. I then now know that I shouldn't be given a narcotic. It's the 0 to a 10 scale, which I particularly don't like because, and it's a fifth vital sign now. Patient comes in the hospital and say, what's the level of your pain? I have a 9. Bang, here's a Dilaudid. Baloney to that. I need to know what you have. What do you have? And then you say, well, I've had a heart attack, for Pete's sake. Use something strong. Use IV morphine, Dilaudid, whatever. But I have to know what you have. And this is actually a national law, a hospital thing, where the nurse has to accept the word of the patient. That's fine. Patients generally honest. They feel this pain, even if it's metabolic pain. Remember, pain due to anxiety and stress. But the gold standard to me, the treatment of chronic pain, is not the word of the patient. It's diagnosis. We got to know what you got. Because why? Because we don't want you to become a drug addict. But today it's the 0 to 10. If you hit the emergency room, and incidentally, to give you a laugh, it wasn't funny when it happened. I now know what a 10 is. I know what a 10 is. I had a kidney stone the other day. That's a 10. That's a 10. And I tell you, lasted only 2 hours. Thank God I passed it. That's significant medicine. But interesting enough, I needed one shot. One shot did it. One shot relieved it. But these medicines are for things like that. And not because you're anxious and hopeless and having bad economic times and you feel like you need dopamine. We got to figure out a good way to treat that. And insurance needs to pay for it. Insurance doesn't want to pay for exercise. They don't want to pay for a Y membership, although it's changing a little bit. The sneakers program under Medicare, which I'm afraid they're trying to stop because it costs them some money. I see a lot of elderly at the Y working out because of the sneakers program. So to pay for Y memberships, to yoga student memberships like AFIT, or to go to Species, or all these other clubs that are springing up to my delight, that I see almost every day a new one. Some really dropping the cost for the people too, which is great for them to take advantage of. That's a better way to treat some of these chronic problems, to get some joy back in your life. So we get the dopamine level up, the serotonin level up. Learn about some dancing. Well, I'm so disabled I can't exercise. Well, I tell you what to do, dance in place. I do it every morning a little bit because I was in Dancing with the Stars, and I can't seem to stop dancing. So in the morning with the dogs and the cats while my wife's making breakfast, I dance for 5 minutes. It brings joy into my life. I feel a lot better. When I get in the car, I turn on Rod Stewart or Gotti and listen to the trumpet and body, and it changes my mood in seconds. I have a stressful day, and I turn on the music in the car, and I'm conducting the orchestra, and my mood changes in seconds. That's joy. That raising the dopamine, so I don't have to drink. I don't have to stop at a fast food place and eat some food to get some joy. So music is a good way. Another good way is breathing techniques. Is do some deep breathing. Transcendental TM meditation, for example, where you sit to do some deep breathing, and to quiet your mind, say a mantra. What's a mantra? A word. And you keep on repeating it, quiet your mind. And maybe visualize something pleasant. You're dancing, walking down the beach, whatever, something pleasant. A word I use anymore, especially since I wrote the poem, is joy. I used to say joy, joy, quietly to myself, and could be loud, doesn't matter, but it quiets your mind. That's meditation with deep breathing. It drops your blood pressure, you'll feel better, and the pain goes away. Another way of getting rid of pain is to become more mindful of it. Mindfulness is a way of teaching, and they treat pain like in Canada. If you just look at the pain, okay? And you don't decorate it with the past, and you don't decorate it with the future. You just think of the pain. You're doing deep breathing, and you're doing some mindfulness and maybe some transcendental meditation, repeat a word, joy, joy, joy. You'll find the pain isn't so bad. The pain isn't so bad. It's when we decorate it with the past, the future, the mortgage, the economic condition, the boss, the wife, the husband, the children. Is when we decorate those things, they're a lot worse. So we need to undecorate our pain, become mindful about it. That's really a good method. And I'm trying to get you to get away from use of narcotics, to go to your doctor and you say, and he doesn't talk to you, that your doctor should say to you, what's going on in your life? Many doctors do that, but some don't. So you have to yourself keep track of the prescriptions you're accepting. Am I accepting this narcotic prescription for good reason? For good reason. That's extremely important. And especially if they hand it to your elderly mother or father, maybe think of another way, question them. In this country, we are much too liberal with these prescriptions. It's going to take a huge change. It's going to take a change in law to stop this, because I'm afraid the Kaching virus is involved here. And a priest told me that term, and I kind of liked it. I think he's right. The Kaching virus is involved in this pain industry, and And if it addicts a whole bunch of people, remember I said it may have killed 18,000 people, but it made millions dysfunctional. They're not working. They're trying to get disability. Their families are ruined. Jobs are lost. And the music and the joy is going away. And I hope in this discussion today you begin to understand and visualize the dopamine circuitry at the base of our brain, from the frontal lobe to the nucleus accumbens, that little millimeter nucleus that is at the base of the brain that is affected by food, for example, and cocaine and heroin, and it secretes tremendous amount of these small molecules that are in the synaptic clefts that give us this overwhelming high, and we feel great, and we're constantly trying to get it back with cigarettes, booze, excess sexual activity, gambling, every sort of thing you can think of. Maybe even sometimes working too hard is an addiction. Sometimes I wonder if I have it. And I mean, some people do that. They never, you have to watch out for that too. You can work too hard and become addicted to it. So the dopamine circuitry, you need to understand it and read my books. The Fraud of Chronic Pain, we need a new definition of the book coming out shortly. And I'm working on another one to get a little more specific here. Opioid prescriptions, the road to hell, and it really is. And I really put it on the line, this book. You might enjoy reading these books. And Nocebo, the Evil Twin, read that to see how studies, angiograms, MRI scans can be overread, and they do the nocebo to you and hand you medications or do procedures or addict you in the process so they can do the procedure again, turn you into a drug addict. Well, you'll be back always for the refill. So, we got to do some more injections first before we give you a refill. I see this, not uncommonly. Don't fall for this trap. So I appreciate very much for you listening to me, and a very tough subject, but it affects our whole health, from food to gambling habits, to drug addiction. Remember that the child has that brain that's not properly developed. So if your child is smoking and drinking, he's going to be a drug addict if you don't watch out. So you have to be very careful to the children and bring joy into their life in a different manner. Thank you very much for listening to me, and you can see our show on Public Access TV. And every Tuesday, 9 to 10, and we'll just keep on teaching you what the mind does to the human body, from pain to diet to stress to music to Asian healing, whatever. We will educate you and have some fun together. And be happy for you to call me, write me, send me a book to read. I will read it, and meet you at Starbucks to discuss it with you. I've done it. So we'll perhaps see you on the next program. We're going to have 5 shows in a row, I think, coming up on proper eating soon. You might enjoy reading that. It's everything about staying healthy. Thank you very much. Namaste.